Okay, let's unpack this. We are diving deep today into a field that I think for a lot of people sounds almost too good to be true. Music therapy. But we're going way beyond just, anecdotal stories or having some calming background noise. We're looking at the hard clinical and neurological evidence that supports using structured music for some really massive health challenges. We're talking anxiety, depression, dementia, even chronic pain.
That's absolutely right. And the sources you shared, they really focus on getting past that sort of feel-good factor. The whole goal here is to understand how the brain is actually responding. What's happening chemically, what's happening structurally, and maybe most importantly, where is the evidence strongest in the clinic? We want to give you a clear map of this therapeutic landscape.
So that's our mission today. We are mapping that landscape. Can these structured, evidence-based music interventions really provide a viable, low-cost and low-risk option, an adjunct treatment for these huge mental and physical health issues? We're really trying to understand the mechanics behind the music.
And to do that, we have to start with the professional groundwork. Because music therapy, it gets confused a lot with just putting on a calming playlist, but it is a really rigorous clinical practice.
So
let's
with
define
the
it then. What's
most
the official
compelling
benchmark for the field?
evidence.
The American Music
The
Therapy
stories
Association,
of children
or
who
AMTA,
claim to
defines it as the
remember
clinical and
past
evidence-based
lives.
use of music
For over
interventions.
50
And these
years,
are used to accomplish individualized
researchers
goals,
at the
all within a
University
therapeutic
of
relationship
Virginia's
with a
Division of
credentialed professional.
Perceptual
That
Studies
credentialing part
have
is,
been
I think, the first big
investigating
takeaway
these
for you.
cases.
Why is that certification so critical? What does that signal?
It signals rigor and, frankly, safety. A certified music therapist, they have the letters MTBC after their name, has gone through specialized education. They've done extensive clinical training. We're talking a minimum of 1,200 supervised hours.
Wow.
Yeah, and they have to hold a current board certification. It's what separates us from someone who, just uses music intuitively. It's a very
They
demanding
might name
profession that's focused
relatives,
on getting measurable results.
describe the
That distinction
layout
is
of
so
a house in a
So when we
distant
talk about these
town,
interventions,
or
the sources
even
you sent break
recall
them down
the
into three main
exact
categories. What are they?
circumstances
We
of
basically
their
group them
death,
by how much
often
the
a
patient is engaged.
violent or
So first you
sudden
have
one.
active music
One
therapy.
of the most
Active. Okay,
famous
so the client is
cases
actually
is that of
creating the
James
music.
Lang.
Exactly.
As
They're
a
improvising,
toddler,
songwriting,
James
maybe
started
singing or playing an
having
instrument.
terrifying
The benefit there is
nightmares
often,
about being a pilot shot
deeply
down in a
psychological. It really
plane
enhances
crash.
self-expression, self-worth.
He
Yeah.
would
It's a
scream
powerful
things
nonverbal
like
outlet.
It's about
airplane
creation
on
and ownership. I
fire.
get that.
Little
Precisely.
man
And the second
can't
type
get out.
is receptive music
As
therapy.
he
So
got
just
older,
listening.
Listening,
he
yes,
shared more
but it's
details.
done within that therapeutic relationship. So it often
He
involves
said
the
his
therapist
name
guiding
was
them,
also
maybe through guided
James,
imagery or a deep
that
dive
he
into song
flew a
lyrics. The goal
corsair
is to help
from a
them
ship
process
called
emotions or
the
memories.
Natoma,
And the third one, this
and
is
that
what
he
really
was
separates
shot
the clinical
down
side
by
from
the
everything else, right?
Japanese
That's
at
right.
Iwo
It's called
Jima.
music medicine.
His
This is where patients are
parents,
simply instructed to listen
initially
to music that's often
skeptical,
pre-selected,
started to
and the focus is purely
investigate.
on the direct
They were
physiological effects.
stunned to
So,
discover
say,
that a
listening to a
pilot
specific
named
frequency
James
while you're recovering
Houston
from surgery.
Jr.
It's
was
independent of any
indeed
therapist
killed
relationship.
at
Okay, so that
Iwo
framework is super
Jima.
helpful. Now let's talk about the
His
engine
plane
driving all
took
this,
off
the
from
brain.
the USS
How is
Natoma
music
Bay,
physically processed?
and he was
It's
the
obviously not just a
only
simple sound
pilot
cue.
from
Not at
that
all.
ship who
music is one of
died
the most
in that
complex stimuli
specific
that we know of
battle.
because it's not processed in
James
just one
Leninger
spot.
had
It
also
activates
drawn
the auditory,
pictures of the
the
event,
limbic, which is your
correctly
emotional center, and your
identifying the
motor
type
networks
of
all at the same
plane
time.
and the
When you hear
Japanese
music, your whole brain
flag.
just lights up.
It's
How
firing
could
across
a young
multiple
boy
domains at
from
once.
Exactly, and that
Louisiana
broad,
know
rapid
these
activation is really the
precise
key to its therapeutic
historical
power.
facts?
So if the whole system is lighting up, what's
Researchers
going
like
on chemically?
Dr.
What are the
Stevenson
neurotransmitters
and
doing?
his
The chemical changes
successor,
are
Dr.
pretty dramatic.
Jim Tucker,
And this is where
are
we see the how
incredibly
for pain and stress
methodical.
reduction. Listening to music you actually like, your preferred music, triggers a release of dopamine,
The pleasure hormone.
the pleasure and reward hormone, right? And it happens especially in that anticipation phase,
This
like right
is
before the best
crucial
part of a
to
song you
rule
love.
out the
It also
possibility
releases
that the
endorphins.
family
These
looked
are your
up
body's natural pain
information
relievers.
and
They create that
influenced the
feeling of
child.
well-being, and they actually decrease your perception of pain.
Which immediately explains why it's so good for relaxation, and I'm guessing it also tackles the other side of the coin, the stress hormone.
It does. Critically, music also works to reduce cortisol. That's the body's primary stress hormone. So by boosting the good stuff and lowering the bad stuff at the same time, you get this really powerful and very low-risk biochemical intervention.
And what's so fascinating here is just the sheer breadth of
So,
the processing when you look
what
at brain
are the
imaging.
scientific
Older theories used to link
explanations
music
for this?
mostly to the
The
right
most
side of the brain.
The creative
obvious
side, right?
one
The
is
so-called creative
fraud.
side. But modern imaging, it confirms bilateral processing. The brain works in harmony. So the right hemisphere, it's processing things like timbre, pitch, melody, the overall emotional feel of the music.
Right.
But the left hemisphere is processing rhythm and the
In the
sequential
vast
structures, the
majority
more
of
kind of
cases, they've
linguistic parts of the
deemed
music.
It sounds
credible.
like music is
There's
the
no
perfect whole brain
evidence of
workout then. It's
deception.
forcing this high-speed, synchronized communication between all these specialized systems.
It really is a conversation between the hemispheres. And that deep activation of the limbic system, which governs emotion and memory, that explains music's unique power to just induce well-being and provide this immediate outlet for emotional
The
processing.
Okay, now that we
idea
have the
is that the
neurochemical side down,
child
let's look
might
at the
have
clinical results.
overheard
Starting with anxiety, this is a huge one for so
conversations,
many people listening.
watched a
The data here is pretty solid. A
documentary,
2021
or seen a
meta-analysis. So
picture,
this combined the
and
results
then
of 32
absorbed
different
that
randomized
information
controlled trials.
without
Wow, that's a lot of data.
realizing
It
it.
is. Almost
Later,
2,000
this
participants.
information
And it found that music therapy
resurfaces as what
significantly
feels
reduced
like a
anxiety
personal
compared to control
memory.
groups
This
right after
could
the intervention.
explain some
We saw
general
that metric in the
knowledge,
sources, the standard
like
mean difference.
knowing
But what does that
about
actually
World
mean
War
for the
II
average person?
planes,
Is it a small
but
lift
it
or a
struggles
really
to
measurable
explain the
impact?
It's a
highly
measurable,
specific
moderate
and
decrease in
often
anxiety.
obscure
So significant
details,
enough to be
like
clinically
the
meaningful.
names of
And a
family
really key finding
members
was
or
about duration.
private
The
events
dose matters.
that weren't
Subgroup
publicly
analysis showed that longer-term
documented.
music
How
therapy,
could
so
a
12
child
sessions or
in the
more, it had a
U.S.
much
know
larger
the
effect than
names of a
shorter
poor
interventions.
So
family's
consistency builds
children in a
effectiveness. But
small
here's where we have to be
village in
critical.
Sri
The study
Lanka?
also noted that the
Then
anxiety
there's the
reduction didn't really last.
possibility of
The effect wasn't
genetic
statistically
memory.
significant at
This
follow-up
is the
once they stopped the
controversial
therapy.
And that
idea
raises a
that
really important question.
memories
It
or
suggests we should maybe view music
experiences
therapy
could
less
be
like a one-time
passed
cure
down
and
through
more
our
like, say, physical
DNA.
exercise. It provides
We
huge
see
benefits while
something
you're
like
doing it, but you need to
this
keep
in
doing it to maintain the
animals.
effect.
For
For chronic
example,
anxiety,
some
ongoing
birds are
MT seems to be
born
necessary.
knowing their
That is a crucial
species'
insight.
migration
Okay, let's move
routes
to depression,
without
which
being
so often comes along with
taught.
other serious
Could
conditions.
complex
How
human
does music
memories
therapy
be
stack up?
encoded
It's
in
a
our
highly effective adjunct
genes?
therapy.
While
But
a
what's really surprising is how
fascinating
it performs
concept,
against
there's currently no
its
solid
closest competitors, you could
biological
say.
evidence
One
to
comparison
support
study
the
found that music
idea
therapy
that
was statistically superior
specific,
in reducing depression
detailed
scores
memories
compared
of
to
a
other art
person's
therapies,
life
Like what?
can be
like
passed
painting,
on
poetry,
It
even creative
doesn't
play.
explain
Music
how a
therapy came out on
child
top.
in one
Wait, why do you think that
family
is?
could
What does
have
music have that
memories
those
from
other
a
arts don't?
person in a
It's likely a
completely
combination of things.
unrelated
Music just has this
family.
unique,
This
direct
is where
access
the
to the limbic system.
explanations
It
start
connects
to
to
get
deep,
more
primal emotion and
speculative
memory
and
in a way
push
that,
the
visual art
boundaries
or
of our
poetry might require
current
a bit more conscious effort to
scientific
get to. Plus,
understanding.
music is so often
Some
social, which
physicists
is a key
and
thing to combat
philosophers
depression.
have
That makes sense.
proposed
Now, within
theories
music
that
therapy itself, there's a
could,
bit of a debate,
in
right? Active
principle,
versus receptive
allow
for
for
depression.
something
There
like
is. Active MT is often
reincarnation.
favored because
One
it helps
area
build
of
those
interest
interpersonal
is
connections, that
quantum
social bond,
physics.
which is so
At the
vital. You're creating
subatomic
something with someone
level,
else.
the world
But
behaves in
receptive
very
MT, so the
strange
passive listening
ways
with
that
guidance,
defy our
that might actually
everyday
be better for patients
intuition.
with really severe depression who might have very low motivation and are more passive.
So it's not that one is better, it just depends on where the patient is on their journey. It's all about personalization.
Exactly, and the benefits went beyond just mood scores. For these patients, MTC also led to measurable improvements in their general quality of life, QOL, and significantly better sleep quality, which is so often disrupted in depression.
Okay, let's shift gears now to physical and cognitive challenges. Let's start with dementia. This is such a pressing public health concern.
Dementia care is an absolutely pivotal area for music therapy. You have these behavioral and psychological symptoms of dementia. They call it BPSD, things like severe agitation, anxiety. Wandering, exactly. And they're extremely difficult to treat with drugs. A lot of the medications have minimal benefits and carry really high risks.
And the sources were pretty firm on their
Instead,
recommendation
it
here.
could be
They
a
were. Music
fundamental
therapy is advocated
aspect
as a
of the
first-line treatment
universe.
choice,
Part
often over
of
the
this
use of heavy
implicate
antipsychotic
order.
medication for these symptoms. That is a major vote of confidence from the clinical community for a non-drug intervention.
That's a huge endorsement. So how does it actually work? How does music help a compromised brain in a patient with dementia?
It's all about engagement and preservation. Music increases cerebral plasticity. That's the brain's ability to change and reorganize even late in life. It can enhance cognitive abilities like speech and memory. And what's really important is that music often taps into memories that are stored in these subcortical, nonverbal parts of the brain. those memories are often preserved even when other memory centers are failing.
Which explains those amazing videos where someone can sing an entire song from their childhood, but they can't remember their own name.
That's exactly it. And personalization is absolutely key. People with dementia respond best when the music has
A
personal meaning to them.
consciousness
For
that
example, studies found that
experienced a
group
life
singing
in
had
the
a greater impact on quality of
1940s
life than just
could,
passive listening.
therefore,
Interactive
also
stuff like clapping and
experience a
dancing along
life in the
also provided measurable
2000s.
benefits. You have to trigger those emotional
It's
circuits.
Okay, now here's
important
where
to
it gets
be
really interesting for
clear.
me.
These
Pain
are
management.
not
We talked about the
mainstream
chemical side of pain
scientific
relief, but
theories
is
of
music actually strong enough
reincarnation.
to tackle
They are
physical pain in a clinical setting?
philosophical
It
and
is, but it's
theoretical
crucial to see it as a
frameworks that
low-cost,
some
low-risk
scientists are
adjunct strategy.
exploring.
It's
They
not
show
replacing
that
heavy
there are
painkillers,
ways of
but it can
looking at
dramatically
the
improve the
universe
psychosocial
where
side
the
of things and
transfer
the
of
overall quality of life during a
consciousness
painful
is
experience. A big review looked at
automatically
44 studies, and
impossible.
40 of them
They
reported a
open a
reduction in
door,
pain
even
levels.
So
if
the vast
it's
majority
just a
showed a
crack,
real benefit.
to
What kind of conditions are we
considering
talking about here?
The applications
possibilities
are
beyond
surprisingly
our
broad.
current
We see pain
materialist
reduction in
model of
post-operative recovery.
science,
And get this,
which
it was even
holds that
effective when patients
consciousness
were under
is
general
purely a
anesthesia.
product
Yes,
of brain
it's used in
activity.
dental procedures to lower pain scores tied to anxiety. It's been shown to help with labor and postpartum pain. The relief is usually described as mild to moderate, but it's real relief for patients dealing with really tough things like cancer or chronic kidney disease.
And just like with dementia, I'm guessing the choice of music matters a lot for pain relief.
It matters intensely, and the sources are really clear on the mechanism here. Music has a much greater analgesic effect if it's chosen by the patient themselves,
Why is that?
because familiar,
Others
preferred music
might show an
triggers those
uncanny
emotional and limbic
talent
mechanisms
for
we
a
talked about earlier.
language or a
You get the dopamine, the
musical
endorphins,
instrument
and that modulates the
associated
pain.
with
And
their
what if you listen
past
to music you
life.
don't know?
In
Unfamiliar
some
music.
If you listen
cases,
to unfamiliar
children
music,
even
say,
have
chosen by a professional,
birthmarks
the
or
pain-relieving
birth
mechanism is
defects
mostly
that
cognitive. You're
correspond
basically
to
just distracting the
wounds,
brain. You're
often
forcing it
fatal
to focus on
wounds,
complex
on the
auditory
body of the
patterns instead of
deceased
the pain signal.
person they
Hmm.
And that
claim to
works,
have
but the
been.
emotional preference just gives you so much more because you get that powerful neurochemical boost on top of the cognitive distraction.
That distinction, emotional versus cognitive pain modulation, that's a really powerful insight. The patient's own agency is paramount.
Absolutely. And, the structural evidence of music's impact, it just reinforces all of this. We have to talk about how music physically rewires the brain.
Yes, I want to go back to that idea of brain plasticity. What evidence do we have that musical experience physically changes the brain's hardware?
The evidence is truly fascinating. Active
So
musical training,
where
especially
does
if it starts
this
early,
leave
drives
us?
observable structural changes in the
On
brain.
one
For
hand,
example, people
we
who
have
had musical training
thousands
before
of
age 7 show
meticulously
a measurably thicker
documented
corpus callosum.
cases that
And
are
that's
very
the superhighway,
difficult
right? The massive
to
bundle of nerve
explain
fibers
through
connecting the two
conventional
hemispheres.
means,
Precisely.
like
And a thicker
fraud
corpus
or
callosum means a
forgotten
greater speed of
memories.
transfer
The
and
level
communication
of
between the two sides of
detail
the
and the
brain. It means
corroborating
musicians can process
evidence
these
are
complex,
often
multimodal
staggering.
tasks like reading notes while moving their fingers and interpreting pitch faster and more efficiently.
What else changes structurally?
Musicians also showed a larger volume of gray matter, that's the tissue with the actual neural bodies, in the sensorimotor cortex
Science,
and the
as
occipital
we
lobe, which
currently
makes sense when you think about
practice
it.
it,
Music is motor
based
control, it's
on what we
movement, it's
can
timing.
measure,
So the auditory
test,
cortex and motor
and
cortex are firing
replicate.
together. The
And
brain
right
literally adapts
now,
by thickening those areas
consciousness
to support that
itself
combined function.
is one
So
of
active
the
engagement with
biggest
music physically
mysteries.
shapes the speed and the volume of the brain's hardware. That's tangible evidence.
It's the foundation of neurorehabilitation. That's why music is so promising for things like stroke recovery, where you're trying to force the brain to reorganize its connections.
Okay, so despite all this really strong evidence, we have to acknowledge that the field still faces some challenges. What's holding the research back?
The main challenge is what scientists call heterogeneity. It's just a fancy way of saying the results are often hard to compare because the methods are all over the place. You look at these studies, and the variables are inconsistent. Who chose the music? What genre was it? How long were the sessions?
Right.
A 30-minute session of therapist-chosen classical music is impossible to compare directly to an hour of patient-chosen rock music.
So that lack of standardization makes large-scale adoption a bit more difficult?
Yes, and it raises a really important point for the future. We urgently need more updated research using advanced neuroimaging fMRI, PET scans. These technologies will let us see the benefits with far greater precision, and that will allow us to finally start standardizing interventions based on hard neurological data.
So what does this all mean? We started out by asking if music therapy is a viable, evidence-based intervention, and the answer, even with some of the older methods, seems to be a resounding yes.
It is. We've seen that music therapy is so much more than background noise. It's a measurable intervention. It physically stimulates pleasure, memory, and motor control circuits in the brain. It achieves significant reductions in anxiety and pain.
And it offers this
They ask
crucial
us to remain
non-pharmacological pathway for
open-minded
conditions like
and to
dementia and depression.
acknowledge that
Exactly.
there are
So the key takeaways for
profound
you as the
mysteries
listener are pretty
about
clear.
life,
The power of
death,
personalization is just
and
immense.
consciousness
Self-selected music
that
is
we have
demonstrably
only
more
just
effective.
begun
It's
to
measured as being
explore.
statistically superior to other creative arts in treating depression. And maybe most powerfully, we have evidence of these tangible structural changes that early musical training gives the brain, enhancing the communication speed between the hemispheres.
It really
And
reframes
what
music as a
happens
tool for
when we're
physical and
gone?
cognitive health maintenance, not
The
just as
search
entertainment.
for answers
Certainly does, which leads
continues,
us to our final
both in the
provocative thought
lab
for you to mull
and
over.
within
If structured
ourselves.
musical training causes an increase in the volume and speed of the brain's main communication pathway, the corpus callosum, especially when it's introduced before age 7, how might routine, structured musical engagement throughout your entire adult life continue to build cognitive resilience and neural connectivity? Could it be a form of proactive maintenance for the brain's physical hardware?